According to the Institute for Patient and Family-Centered Care, person-centered care is defined as an innovative approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. Working within the patient's beliefs and values includes developing a complete picture of their cultural and personal viewpoints and how they interpret and respond to occurrences based on these positions. Understanding another person's spiritual, physical, and social needs is an important requirement in cultivating an accurate and safe sense of patient individuality and understanding the ethical and moral foundations of their personal growth and development. Every individual person has his or her own story to tell. The experiences and events of each person's story form the fundamentals of the decision-making process and preferred way of life. A deep understanding of this concept tailored to each unique patient is an integral element in creating an individualized care plan.
Nurses must share decisions with their patients and involve them within their care. Not only does this aid with making decisions in their best interests, but it gives them autonomy and self-determination. A role nurses must include is patient empowerment. Through shared decision-making, this allows patients to have an equal say within their healthcare decisions. Self-efficacy can be expressed and promoted through sharing decisions. Decisions also may place patients in difficult situations. Nurses should inform patients on their choices and take their needs into consideration. It is not as simple as asking, "What do you want?" Shared decision-making may also occur throughout the multidisciplinary team. Sharing decisions with colleagues and patients may allow a variety of ideas to flow to potentially deliver exceptional care for the patient. Clark et al. 2009 stated that patients have a duty of care to themselves and nurses have a duty of care to the patients. With this in mind, nurses must collaborate with patients in order to develop a therapeutic relationship and positive outcomes. An example of this may include informing a patient on chemotherapy options and the possible implication and what is involved. Informing a patient upon these decisions may allow them to have an ability to make an informed decision. Having a shared decision will lead to better outcomes for both the nurse and the patient, allowing care to be more efficient and effective in the best interests of the patient.
Engaging authentically encompasses the nurse's duty to develop a rapport with their client, advocate for their care needs, and be their point of contact in the healthcare setting. For the practitioner, engaging authentically involves developing a relationship, effective interpersonal communication, and the concept of cultural safety or holism. Working within a multidisciplinary team means that both the nurse and the patient must develop rapport and communicate effectively. Establishing meaningful connections reinforces the NMBA's code of conduct that nurses provide safe, person-centered care and, in partnership with the person, promote shared decision-making and delivery between the person and health professionals. As described in Potter and Perry's Fundamentals of Nursing, interpersonal communication is two-part and involves the capacity to convey thoughts, feelings, and attitudes through spoken, written, and non-verbal means in order to exchange ideas and construct meaning. Furthermore, cultural safety is an integral part of holistic care and authenticity, as understanding the health situation from the client's point of view and employing sensitivity towards the attitudes, values, and beliefs will aid safe and holistic care. Being sympathetically present through the delivery of care connects healthcare professionals to the client by focusing on getting to know their values, beliefs, and healthcare needs to ensure social well-being. Having the ability to be available to each patient in their time of need and gaining an effective outcome can be achieved by empathizing with choices they make, understanding individual needs, and acknowledging cultural differences. Being sympathetically present toward the patient involves a high level of interpersonal skills, as it is always important to understand patient perspective in their healthcare needs while providing patient-centered care when working in conjunction with other disciplines. Furthermore, the practitioner must first have a high level of emotional intelligence in order to understand their own circumstance in relation to that of the patient, and therefore provide care that meets the patient's needs by supplying emotional support throughout.
Holistic care is defined by McCormack and McCants as the provision of treatment and care that pays attention to the whole person through the integration of physiological, psychological, sociocultural, developmental, and spiritual dimensions of your persons. The challenge to providing consistent and effective holistic care is the narrow-focused and task-orientation mindset that occurs in hospitals. The key, which is hard to achieve, is to step back and look at the bigger picture. Are all of my patients' needs being met? Sometimes, to provide holistic care and to look after the socio-cultural, psychological, and spiritual aspects of the patient, the nurse must reach out to other members of the healthcare team for direct patient care. For example, a social worker, therapist, or religious worker. Holistic care of the patient also includes being aware that every family and circumstance is different and adjusting appropriately to your patient's environment. To provide safe and effective holistic care, the nurse needs to bring their knowledge, experiences, and abilities to the table and apply what's necessary to every situation. Being able to be aware and conscious of not only the daily tasks, but also the patient and everything that encompasses them is important in being competent in providing holistic care. Person-centered outcomes are associated with positive healthcare experiences for both the healthcare providers and the patients. Co-design based on experience entails collecting experiences of both patients and staff and collaboratively drawing these experiences together to improve the healthcare encounter with a mutually shared understanding of the outcome goal. Self-management support assists in the development of knowledge, skills, and management of chronic conditions. This concept involves education, motivational interviewing, and health coaching, allowing the patient to maintain a level of self-confidence and control over their own health conditions. Each patient has different financial circumstances. Therefore, developing a personal health budget in conjunction with the patient's needs and economic ability assists in formulating a care plan that is appropriate and suitable in achieving their healthcare objectives. Shared decision-making is a process that directly involves the patient's input and understanding when developing an individualized care plan and management strategies. These models can also often extend to involvement of the patient's family and loved ones where applicable. Through planning and collaborative care, patients can develop a better understanding of their conditions, health objectives, and how they can maintain control of their own care.
Cultivating a feeling of well-being and a healthful culture when interacting with clients must include encouraging independence, affirming individuality, involving families in decision-making, and providing support to the individuals when needed. Hughes defines independence as the ability to achieve, make decisions, and initiate actions by oneself. Empowering people to do the simplest tasks by themselves promotes independence and well-being. Every person is different and should be treated as an individual regardless of culture, race, or background. Creating an open environment for individuals and families to ask questions freely creates trust in care and in practitioners, as they have provided options for families to choose the kind of care they prefer. A healthful culture within the healthcare setting means that the nurse is listening empathetically, actively building rapport, providing support such as grief counselling or a psychologist when needed, and respecting one's privacy and confidentiality.
An example of a healthcare initiative to support person-centered care is flexible care. A patient's ability to make some, but not necessarily all, of their healthcare decisions can be dependent on various factors such as physical disability or cognitive impairment. A patient may have the ability to maintain independence in personal care such as feeding and washing some of the time. Therefore, acknowledging and addressing these potential variations in needs is vital in order to maintain their dignity and involvement in their own healthcare. Flexible care also includes potentially giving the patient the option to perform tasks such as maintaining a fluid balance chart or maintaining therapeutic supplements. By doing so, the patient is placed at the centre of their decision-making, ensuring independence and autonomy are preserved in a supportive environment. A nurse-led healthcare initiative supporting person-centered care in the perioperative setting is developing a nurse-patient relationship in order to create a sense of trust and security. This involves addressing the patient by their own name, giving them the opportunity to ask questions, by involving them in their own care, and by being listened to. In order for a nurse to develop a trusting relationship with their patient, they need to allow their patient the opportunity to tell their individual story, whilst incorporating vital concepts of caring conversation such as listening, presence, and touching. Showing concern, reducing anxiety and pain, promoting relaxation, and giving closeness and warmth are all provided through the act of touch. Verbal communication with the patient through phrases such as "you are not alone" and "this will not hurt you" reinforce that sense of security within the patient, therefore promoting healing and the concept of person-centered care.